Hi, I'm Christina Seston, and you're watching a special edition of The Truth About Diabetes. If you or someone you know has diabetes, this is important television to watch. If your children are overweight or diabetic, this show may contain critical information. My guest today is Dr. Kim, and he's a PhD from MIT. Dr. Kim, welcome to the show.
Thank you very much.
Dr. Kim is here to talk about this deadly disease of diabetes. So, Dr. Kim, 17 million cases of diabetes in the U.S. alone.
That's what I heard.
2,500 new cases diagnosed every day. So there are people that call this an epidemic.
That's correct.
So what is it about this incredibly high incidence of diabetes in the last decade?
These days we observe explosive growth of diabetes incidence all over the world. So for the last 10 years, even children, a lot of children get diabetes. So this is a global epidemic.
Right, right. And so we're going to talk a little bit more about this upsurge later in the show. But in the meantime, I've heard statistics reporting that 45% increase in childhood diabetes. Is this correct?
In China, half of new diabetic patients are children. And then in Japan, 21% of all children are diabetic. We are talking about something very serious here.
Yes, yes. It's very, very high. So, Dr. Kim, for those of us that don't have diabetes, can you explain to us what diabetes is?
Diabetes is basically a person's ability to metabolize carbohydrate is impaired.
Right.
So basically blood sugar does not get burnt inside the muscle. It stays in the blood. Of course, you observe high blood sugar in the blood. So that's what we say diabetes is.
Right,
Yeah.
right. And we've all heard these terms, type 1 and type 2.
Yeah.
Can you explain the difference for us?
Yeah, basically type 1 is for certain reasons such as what we call autoimmune process. For any reason, pancreas of a person does not produce insulin. So they have to rely on insulin injections every day. So, but in the meantime, type 2 diabetes is even though the pancreas produces insulin, it's not sufficient, or even though a sufficient amount of insulin is produced, it is not used efficiently because body resists its own insulin.
Right.
So type 1, type 2 are different like that.
Right. And so which type is more common?
Type 2 definitely.
Type 2.
Yeah, 90% of
90% of cases. Okay. And type 2 I've often heard referred to as adult onset diabetes.
Because traditionally we observe the type 2 diabetes happens in people's middle age, in their old ages. But these days, as I just mentioned, as more and more children get diabetic, that is a wrong name anymore.
So a bit of a misnomer with
it's
that.
It's misnomer, yeah.
So Dr. Kim, what is it about childhood diabetes that is so bad?
Because for a few reasons, diabetes is basically a progressive disease. Therefore, if a person gets diabetic at the early stage of their life, they are getting more and more serious at the later stage of their life.
Right.
Another reason, which is very serious, is if people begin to use these pharmaceutical drugs in their teens,
right,
they begin to lose, these pharmaceutical drugs begin to lose their effectiveness over time. So in their late 20s, in their 30s, these drugs begin to lose their effectiveness. So they have to use more dosages or they have to rely on insulin. But even these, they begin to lose their effectiveness. So in their early 30s, they will face this terminal stage of diabetes where no drugs, no injection work. And then they just will begin to experience blindness, amputation, kidney failure. So, in 10 years, the world is going to face a global crisis here.
This is serious.
This is serious.
Yes. So we'll talk more about the pharmaceutical drugs a bit later. But in the meantime, I've heard that people saying children outgrow diabetes. Is this correct?
Absolutely not true. Nothing is
Not
further
true.
from the truth. Children don't grow out of diabetes. They don't outgrow diabetes. It's progressive disease. They are getting worse and worse. So it's just a wishful thinking. That's not true.
Strictly wishful thinking. No cases of children growing out of diabetes then. So what is it about diabetes that is so difficult to fight?
Diabetes is basically involves a certain inherent problem in your metabolism. So there are certain reasons why this vicious cycle continues. For example, For diabetes people, as I said, the blood sugar does not get burnt inside the muscle, right? Muscle are constantly experiencing malnutrition. Therefore, muscle transmits a signal to brain that I need more food, I need more food.
I'm hungry.
While the foods are already, too much of foods are already in the system.
Right.
At the same time, this extra insulin that remains in the blood, that also signals the same signal, hunger signal. Also, this extra insulin turns this extra blood sugar into fat. So there are certain reasons why these diabetic people cannot control their metabolism as easily as ordinary people do.
Right. Which sounds like it leads probably to weight problems.
That's correct.
Right.
And then the weight problem and obesity and diabetes, these are two sides of the same coin.
So they're connected.
Yeah,
They're connected.
70% or to 80% of obese people have diabetes, and 70% to 80% people of diabetic people have difficulty in control their weight.
So they're very connected.
They are coming from the same root.
Yeah. So Dr. Kim, I've also heard diabetes referred to as the silent killer.
Yeah.
What does that mean?
Because even though you have diabetes, you don't feel acute pain right away until you reach this terminal stage where you have all the complications surface. Until then, you don't actually feel this high blood sugar.
So what is that length of time leading up to it? You say when you first have diabetes, it sounds like you might not even know that you have diabetes before the symptoms show. Is that correct?
But even before the diagnosis, according to the statistics, once a person is diagnosed as diabetic, it's quite likely that 7 years before the diagnosis,
7 years.
Yeah, onset already started. And then statistically, even though individual case varies, statistically, every 10 years, we expect to see the rise of about 100 milligrams per deciliter. This progresses.
It sounds incredibly progressive.
Yeah.
And I'm curious about the connection like with hereditary or genetics. So for instance, if my mother or my uncle or maybe even my grandmother had diabetes, does that make me more predisposed to diabetes?
Yeah, some people suspect that there is a diabetic gene, but according to my knowledge, we haven't found that particular diabetic gene, but we know that there's a genetic disposition. So basically, if a parent is diabetic, the likelihood of children getting diabetic rises by 10%, becoming 40%.
Right.
And if two parents are diabetic, likelihood of children getting diabetic becomes 50%. If one sibling is diabetic, then 70%.
So it increases rapidly with more people in your family that have diabetes.
Therefore, my point is even before actually diabetes hits a person, if you see that genetic disposition around yourself, you should take action right away.
So be aware.
Yeah.
Right.